Hello, everyone. Welcome to the Academy of Nutrition and Dietetics social media Q&A about the dietary guidelines for Americans. I'm Mike Zandi. I'm the Director of Communications for the Academy. And while we wait for folks to join the stream, sorry, we had a couple technical difficulties, so we started a couple minutes late here. I just want to go over a couple housekeeping items before I bring on our guests, Alison and Charla. We've received a lot of questions about the DGAs in our inboxes, on social media, and webinars that the Academy has participated in. We also asked you to submit questions in advance of this Q&A. So what we've done is we've compiled those questions, and we're going to address all of those first. From there, depending on how much time we have left, we're going to try to address as many questions as possible in the comments. If we don't get to your questions during this session, we're going to be sure to follow up with you with a response. Now, with that, I'm going to turn it over to our Chief Mission, Impact, and Strategy Officer, Alison Steiber, and unfortunately, Kelly Horton, our Senior Vice President of Public Policy and Government Relations. She couldn't make it today. She's feeling a little under the weather, so stepping in for her is our Senior Director of State Legislature and Affairs, Charla Burill. So, take it away.
Wonderful. Thank you so much, Mike. It is such great for us to be able to be here today and to answer some of these burning questions that we've been receiving regarding the brand new dietary guidelines for Americans. So let's kick it off and get started with our first question that we've been getting a lot, which is really focused on what's been changing with the dietary guidelines between the previous iteration and this iteration. And of course, while there's a lot that's the same, there are those things that are different, and we can kind of talk just a little bit about some of those differences. So I think one of the big topics that people have been really buzzing about is saturated fat. And these new guidelines maintain the same cap that the old guidelines have had in previous iterations, which is that you should take in less than 10% of your total calories from saturated fat. And of course, saturated fat are those that are solid at room temperature. They can be found in a variety of foods, but most often they are animal protein foods. However, what's a little bit different in this iteration is there were some recommendations to take in healthy fats. And some of those healthy fats that were suggested were, of course, from whole milk and also from butter. And there was a mention of beef tallow. And so that is certainly new for us. Other things that have come up. Let's talk about whole milk. This new guideline really emphasizes whole milk. And while whole milk has many of the same nutrients that its lower fat or skim versions would have, the big difference is fat content. Now, it's not hugely high, but still we have about 3.5% of the calories come from fat. And so people who feel you can fit that into your dietary patterns, that is really being recommended with these new dietary guidelines. Protein's another one that's big this time. Always before, they followed what we call the dietary reference intakes, which was at 0.8 grams of protein per kilogram per day, which is fairly low and is just the basics of what you need to continue with metabolic processes. These new dietary guidelines take it upon themselves to recommend significantly higher levels of protein. And so they recommend between 1.2 and 1.6. We dug into their Science Foundation document to see where did that evidence come from. And it turns out there are clinical trials that show improvements in muscle function, particularly when paired with resistance training. And so protein at this level probably is safe for most individuals to have across the lifespan. But if you want to learn more about these protein conversation, we're going to have a webinar in partnership with the American Council on Exercise coming up later this spring. So I would encourage you to stay tuned there. It's also important to note that typically the dietary guidelines does not recommend a dietary reference intake. That's usually what the National Academy of Science, Engineering, and Medicine does. So that was a bit of a deviation from there as well. Sodium, let's talk a bit about sodium. So this didn't really change. We're still recommending 2,300 milligrams per day. They break it down by age, but in general, they are recommending reduction in sodium. A big way that they think about how to reduce that sodium is to reduce your highly processed foods. And we can talk a little bit about that term and why some of those recommendations are, but that is a big push. They do, however, interestingly say that if you want to season your foods, using herbs and spices and salt is a way to do that. So just being cautious with how much salt you add to ensure you can stay within that recommendation. It doesn't take a lot of salt to hit 2,300 milligrams. And then the next one, which is very interesting. So low-calorie, non-nutritive sweeteners have been something we've been talking about for a long time, and there's a lot of controversy around. And part of that controversy is you're hearing different messages depending on the outcome that's been looked at with that entity. So, for example, there's good evidence to indicate safety up to a certain level. We have had different organizations come out and say that you need to stay within an average daily intake, but most organizations say that it can be used safely in moderate amounts. And so the American Diabetes Association says this, the American Heart Association says this. Interestingly, though, the World Health Organization talks about the fact that it's not actually very effective in helping in weight reduction or weight control. So if that is why you're choosing to use the low and no calorie sweeteners, that may not be something that you want to choose to do because the evidence doesn't really support it. So let's go down a little bit further. I want to talk about grains. So, when you look at the text of the new dietary guidelines, you can see that they talk about whole grains, the importance of whole grains, lentils, whole grain flour. They talk about nuts, seeds, legumes. They talk about all those different kinds of entities. But when you look at the graphic, you might say to yourself, why is whole grains at the bottom of that graph? And what I encourage individuals and practitioners to think about is to really focus on the words that they are saying within the recommendations. Eat whole foods, eat appropriate amount of calories for you as an individual, eat lots of whole grains and different aspects of protein, whether they're animal protein or vegetable protein, both are good for you, and you can accrue muscle mass and maintain lean body mass using those kinds of proteins. So I think that the graphic doesn't do the text justice when it comes to grains. We also know, importantly, that flours, one of the places that we have supplementation of folic acid. And folic acid is an incredibly important nutrient, particularly for women of weight-bearing age or of childbearing age, and that they need folic acid to try to reduce the prevalence or the probability of having any kind of neural tubal defects. And so this has been shown to be a highly effective way to reduce those in our population. So grains have lots of things to be thought about, but I just want to throw that out for consideration. So ultra-processed foods, that was another thing that these new dietary guidelines came out very strongly and say that this is the first time we've ever had a statement to reduce our ultra-processed foods. We know that in previous iterations of dietary guidelines, they have always recommended a reduction of processed foods. The word ultra-processed food is not necessarily one that was used in previous iterations, and it's not used in this dietary guideline either. And part of that is because we don't have a FDA sanctioned definition of ultra-processed foods. And so they chose intentionally not to use that term. However, the bottom line is we all agree that reduction of ultra-processed foods is good and should be done as much as possible and is feasible within your context and setting. I think the last thing that I'm going to talk about, that's just a little bit different between this and the last guidelines, is alcohol. So in previous dietary guidelines, you may remember that they said a certain limit for men and a certain limit for women. 2 drinks for men, 1 drink for a woman. This new dietary guidelines just says reduce dietary intake for overall health and do not give specific limits. It's not to say that these guidelines are saying, yes, alcohol is fine, you can go out and drink alcohol, but rather they're not giving an exact amount. And I think that is a difference, and people have brought that out. I think it's important to note, for public health, that there's good evidence to indicate that the more you drink, the more probability you have for negative outcomes. and that low or very reduced amounts of alcohol intake is healthier for everyone. So I'm going to pause there with that. What's different for the dietary guidelines? See if Charla, do you want to jump in and add anything, or should we move to the next question?
The only thing I would note, and hopefully I'm streaming okay. I know I was delayed before, but with the reference to the highly processed or ultra processed is anyone that's looked at it knows that what they're referring to is those foods that are high in saturated fat, sodium, sugar. So we know within ultra processed foods, we can have foods that are really healthy for us, whether that's yogurt or whole grain. So, just a point of clarification that is part of the, what is being determined at the federal level with the definition that they're going to provide. When they're talking about highly processed, we're not saying that all ultra processed foods are necessarily, negative for our diets.
Thank you. That's important context. Appreciate that. Okay, I want to say one more thing about some of these things. Saturated fat, ultra-processed foods, and others can be found on a great resource that is on eatrightpro.org, and that's our nutrition fact check. Our nutrition fact check was designed to help practitioners and the public have the evidence so that they can see what the evidence says and make individual choices that meets their own individual dietary needs. And so you can see we have artificial coloring, we have ultra-processed foods, we have seed oils, and just recently we've released a new one that is on raw milk. So I encourage you all to take a look at this nutrition fact check. Within each of these topics, you're going to have a one page that's sort of lay term. You're going to have a summary of the science that currently exists. And often there's a video that has someone talking about the evidence that's out there and how we can interpret that evidence. So I want to highlight this important resource. I think it will be very useful, both for consumers and the public and practitioners. Okay, let's go to the next question.
And I would just add also helpful.
Go ahead, Charla,
Yeah,
please.
I'm sorry for the delay again. I just wanted to add regarding the nutrition fact check. It's also a helpful resource when we look at advocacy and making sure that we're helping to inform evidence-based nutrition policy. At the state level, we've seen a lot of legislation over the past year addressing some of these topics that we have addressed in our nutrition fact check information. So ultra processed foods, seed oils, food dyes. And so having that resource to really inform what this legislation that is moving forward. I think keeping in mind that we've seen many bills, over 130 bills in the last session, somewhere addressing these issues around food. And this legislation's kicked off, and we're just continuing to see more of that. And I think part of the concern, we can talk about many things, but at the federal level, they are working on guidance, and they are FDA is reviewing the safety of these different substances and additives. And when we look at the legislation across the country, having a state-by-state solution is not really the answer that really is going to wreak havoc on our food system. And so I would utilizing these resources from an advocacy side to be able to have informed discussions with your legislators to make sure that what they're enacting has the intent and is able to accomplish what they're seeking to do.
Charla, that's absolutely right. And really the impetus to us starting the whole nutrition fact check was these state issues that were coming up and that our policy team was seeing. And so that drove us to say we have to give our members, our practitioners, the consumers, something that they can utilize to know what the evidence actually says as they're making these decisions. So thank you, that's great. So the next question was talking about how is the evidence evaluated and why were certain recommendations changed from the original 2025 Dietary Guidelines for Americans Committee report. So this is a bit of a long question that has a complicated answer to it. But in general, we know every 5 years that there's a dietary guideline that is released. And a number of years ago, the National Academy of Science, Engineering, and Medicine was tasked to take a look at the process that these dietary guideline committee and the recommendations followed so that it was as rigorous as possible, it was as transparent as possible, and that we would have the best guidance for our population. So the National Academy did that, and in 2025, or probably 2023, the combined agencies between the Health and Human Services and the USDA, which are the two agencies that come together to create the dietary guidelines, looked carefully at those National Academy documents and made some very conscious changes. Things like they put forth the questions that they were going to try to answer in the 2025 guidelines in advance so the public could see the questions and could provide comment. They also had multiple public meetings where the Dietary Guideline Committee would come together and publicly take comments and discuss the findings as they had them. One of the big things that they did in the public was show all the dietary pattern modeling that was done by Dr. Chris Taylor and others. And they talked about the traditional American diet versus a vegetarian diet versus a healthy American diet, and looked at and predicted outcomes from that. So it was a very intentional process. These guidelines that we received did not have the same timeline to manage, to work with. And so for reasons undisclosed, they did not use the report that committee had come up with, but rather gathered different experts together, created a document that without public transparency in meetings. They had that group of experts review the science findings, and then they developed the recommendations. So it was a much shorter, truncated time frame. We didn't get to see the process. We didn't get to have public hearings. The questions that they were trying to answer weren't given to us in advance. But they did do good disclosure. So you can see the reviewers, all the disclosures that they have. And I think that's an important thing. The other thing that's important within the Science Foundation that I think is quite helpful is that they put a table that shows you what the recommendations were and whether they chose to keep them, adopt them partially, or outright reject them. And I think when you look at that table side by side, you can see there's quite a few things. Eat fresh fruits and vegetables, have good sources of fiber. Those are all things that they maintained. And you can also look at the pediatric guidance that they gave and see what they continued with. I think they were stronger with the no added sugar, but they continued many of those statements. So there are definitely differences in the methodology that was used. There are differences in terms of whether they didn't even use dietary pattern modeling at all in these new guidelines, whereas they did in the original. They used some systematic reviews, but they weren't intentionally determined in advance the questions and then do the systematic review. They used existing systematic review and pulled that in and used that evidence. So there's a little bit of shifting here. And I think that perhaps, in 5 years, there's learnings that we can have about how to be more transparent and how to ensure that the public knows what's going to happen and what questions are being asked in advance. Charla, did you want to add anything to that? Okay, so let's go and talk about what the Academy is doing next. So there's a number of initiatives going on at the Academy to really dive into different aspects of this. As I mentioned, we're going to have a webinar solely dedicated to protein, what we're doing jointly with the American Council on Exercise, where we really look at these new amounts, these new levels of 1.2 to 1.6 and talk about what they mean for the public. We're also having the research committee, which is a group of volunteer leaders that take a deep dive into the Science Foundation and talk about the evidence that they're using to inform these guidelines. And we will be coming out with more information from the results of that deep dive. So I think that we will continue to have opportunities like this one to answer questions live. We will have things for our membership where we can talk about what's happening, how we're interpreting the evidence. And of course, we always want to meet the needs of the public. And so certainly, we'll be having more conversations about how to do that, whether it's creating resources or directing people to opportunities for good information as you try to improve the health of your dietary pattern. Next question is a little bit tougher. What do we use now instead of the inverted pyramid? Is MyPlate okay to use? The Academy of Nutrition and Dietetics does not own MyPlate and of course has no stake or did not help create in any way this new pyramid. What I would say is that practitioners need to have a range of resources that they utilize when they're trying to help their clients. MyPlate was an excellent resource. It really was good because it gave serving ideas. You have a sense of the serving of how much, how many fruits and vegetables, how much protein, how many grains, etc. If you have access to MyPlate, there's nothing to say that you can't continue to use it. We are not planning at this time to make any resources related to either the inverted pyramid nor MyPlate, but rather we'll see what happens with the federal government as they begin to roll out new resources. And I'm sure that they will be doing that to help support the information that they have provided. Charla, anything to add about that? No. I think not. I think Charla's got it.
I'll just go back for a quick second to what the Academy's doing. I think is we're looking. Oh, is it delayed again?
Yep, right. I think we're a little delayed.
About this.
Sorry.
The dietary guidelines were rolled out. We don't. Can you hear me? Or no?
Yeah.
Okay. I'll let you move forward.
Yeah, the one other thing I want to say about that is certainly the policy team is doing a huge amount on a state by state level, and I don't know if that's what Charla was going to bring about. There's lots of advocacy that happens throughout the 5-year span before each new guideline is released, and that will absolutely continue. There are also some great resources that individuals can go to at universities. And of course, we have our eatright.org, which is our public-facing website that also has many great resources for the public to help them develop and have healthy eating patterns. So I would certainly recommend people could go there. Different universities like Harvard and Tufts and Oregon State, UConn, the University of Connecticut, Rhode Island, all of those have great. Oh, good. So now you can see on the screen, these are some of our great resources from Eat Right. I think you can see all the different food aspects to help people. And of course, our new campaign, A Seat at Every Table, is highlighted right there on the front. So our eatright.gov.org is a great website and a great resource for your clients and for the public in general. Terrific. Okay, let's move on to the next question. When we talk about implementation, and I think different aspects of the guidelines, different individuals will have different aspects. But I want those of you who are practicing registered dietitian nutritionists or in DTRs, our job is to meet the individual, assess the individual or the population or the group, the community that we're working with, and make recommendations based on their needs. So if I'm working with an individual who has a desire to reduce their weight or to manage their blood pressure or to reduce their cardiometabolic risk profile, I'm of course going to design their recommendations for them as an individual. The dietary guidelines are for a broad population. They're not meant to target Mrs. Smith. They're meant to target the population of the United States. We as dietitians and as nutrition and dietetics professionals are there to help individuals and communities and different groups, subpopulations. And we can do that with our expertise, use our clinical judgment, and make individualized recommendations. And so I don't want us to lose sight of that as we with the chaos of some of this new guideline information. But that is what dietitians do best, is to give individualized, personalized nutrition recommendations. When we think about implementation, we have to think about setting. Are we talking about school nutrition or are we talking about something else? I think if depending on your setting and the population you're working with, you're going to have multiple different ways of thinking about implementation, whether it's thinking about the fruits and vegetables and really focusing on that, focusing on the good protein sources that are feasible and accessible for your population and are culturally appropriate. I think what the other piece that dietitians do really, really well is think about personal preferences, think about culture, think about religion, think about cost and affordability. And so I would encourage you, as you're thinking about how to implement these new guidelines, don't get too stuck. You know how to do this. We've been doing this forever. We use our best judgment, we focus on the things that are evidence-based, and we implement them. So I think I don't think we have any burning questions from the audience at the moment. So I will look at one more question that says, how do I counsel patients without losing their trust? And I think that this goes to this idea of whether or not these new guidelines are science or evidence-based. There are certainly aspects of these new guidelines that are right in line with what we've been saying all along. Eat food if you can, if you have the capacity, the resources, and the time, and you can cook your food from scratch, that's outstanding. Definitely encourage that. But if you can't, how can we work with you as an individual to make sure that we are creating the best dietary pattern that fits with your needs in your lifestyle, your culture? And I think that doesn't change anything. Continue to do that. Continue to read the evidence. Continue to know how to help your patients be as healthy as they can with the knowledge that you already have. And those aspects of the dietary guidelines that are in line with that is the perfect way to do that. So I will stop there and thank you all for participating. We were excited to be able to have this opportunity with you. Mike.
Thank you, Alison. Thank you, Charla, so much. Just want to make a note for everyone who joined late that this will be recorded. And if you have any follow-up questions, please, reach out to us. And thank you so much for joining us and have a great day.